go live now.
Good evening, everyone, and welcome to today's webinar on what's new in flu, current challenges and management option. For this webinar today, we have with us our guest speaker, and I would like to take a moment to introduce them. Today, we have with us Dr. Ankit Kumar. Dr. Ankit Kumar is Assistant Professor, Department of Respiratory Medicine, King George Medical University, Lucknow. Dr. Ankit Kumar is specialized in chest medicine, and he has 10 years of clinical experience and vast experience treating the COVID-19 patients. Dr. Ankit Kumar specialized as an asthma and chronic obstructive pulmonary disease specialist, pulmonologist, diabetologist, critical care medicine. Dr. Ankit is a member of Indian Society of Critical Care Medicine and American College of Physicians. Along with Dr. Ankit Kumar, today we have with us Dr. Kapil Rathi. Dr. Kapil Rathi is specialized in internal medicine, chest medicine, diabetology, cardiology, and critical care medicine. He has 14 years of clinical experience and vast experience of treating almost 1,200 plus COVID-19 patients. Besides completing his graduation and post-graduation in medicine, he underwent the specialized training in diabetology, cardiology, and critical care from various reputed national and international institutes. Dr. Rathi is an active member of Kurla Suburban Doctor Association and Andheri Parle Physician Association and various other medical bodies present in India and abroad. Dr. Rathi has also been co-investigator in various clinical trials and surveys conducted by Indian and multinational companies. So with this introductory note, I welcome all the delegates for today's webinar, What's New in Flu, the Current Challenges and Management Option. For the same, I request Dr. Ankit Kumar to start the session.
Thank you, Manohar, for your kind introduction, and I also would like to thank the Apr Healthcare team for giving me such opportunity. Just a second, let me share my. Is my screen is visible?
Yes, sir, your screen is visible now.
Okay.
So I request full screen. Yeah. Okay. Thank you, sir.
So my topic is what's new in flu and current challenges and the management option. So let me start with the challenges. First, I would like to start with these highlights of the newspapers. You can see on my screen H3N2 virus linked to spate of high fever and cough cases. Cold wave, fog, and rising pollution triggers surge in seasonal flu cases. Private hospitals start flu screening as number of COVID admission rise in Kolkata. If you read these highlights, you can easily identify the challenges faced by the healthcare workers and policymakers in these years about the flu, COVID, and SARS. So let me start one by one with the challenges what we are facing in these years about the flu. Here you can see a study published in the Indian Journal of Medical Mycology, and they did this collected data over 7 years and published their result in 2019. And what this is conclusion of this study said to us, influenza positivity started with onset of monsoon and peaks during the post-monsoon month. So अगर हम इस स्टडी का समझें तो ये कहती है कि जो फ्लू का इंसिडेंस है वो जुलाई अगस्त और जनवरी फरवरी में होता है. But what we are facing now? We are facing now flu is not a seasonal but is a perennial condition. So this is the month of April, and we are still facing the high load of the viral infection. And you know, the H3N2 infection is most common in the air. And the next challenge, other than this changing paradigm from the seasonal to perennial condition, is this flu not only infect adult population, it is also infecting the pediatric age group. So this is a one challenge. And next to that is, here this is same thing what I'm showing, the changing paradigm from the seasonal to wave. And this is a study done by ICMR network of laboratories. and between the January 2 to March 5th, they collected data for 9 weeks, and they see the persistent presence of the influenza virus in the community. If you see the almost persistent cases all over the 9 weeks, and the main subtype of the influenza is S3N2. Next to that, the challenge is symptoms of the flu. Symptom of the flu is running nose, fever with cough, body aches, sore throat, vomiting, and diarrhea. And these are not very specific symptoms. These symptoms shared by the influenza-like illness, S3N2, severe acute respiratory illness, COVID-19. So this is another challenge we are facing. Third challenge is, if we compare the number of cases and death due to influenza in year 2015, 18, and 2019, the number of cases of influenza and death caused by the influenza both are rising. So this create an alarming situation in India. Now let's talk about the influenza. Influenza disease क्या है? Flu क्या है? We know that it is an infectious disease. ये जो influenza है, basically influenza virus की वजह से होता है, and it is highly contagious. एक मरीज जो इन्फ्लुएंजा से पीड़ित है, जब वो खांसता, छींकता है, वो बातचीत करता है, तो उसके माउथ से निकलने वाली ड्रॉपलेट जो है ना, वो हवा में सस्पेंडेड हो जाती है। एंड जब एक नॉर्मल हेल्दी पर्सन उस एयर में जाता है और सांस लेता है, तो वो भी इससे इन्फेक्ट हो जाता है। एंड सेकेंड, अदर इंपॉर्टेंट पॉइंट टू अंडरस्टैंड इज एक्यूट वायरल इलनेस, राइट? एंड इट कॉज डिजीज फ्रॉम माइल्ड टू सीवियर इलनेस, एंड समटाइम the disease caused by the influenza virus is that much serious that can cause hospitalization or death of the patient. If we talk about the type of influenza virus, basically, primarily, influenza is 4 types: influenza A, B, C, and D. Primarily, influenza A and B cause significant, or you can say severe disease in the humans. And if we see the particularly influenza A divided into subtypes that you persistently hear about, H1N1, they are the S3N2, they are all the subtype of the influenza A virus, right? And the variation in these two glycoproteins that are found on the surface of the influenza, that is, one is the hemagglutinin and second is neuroimmunities. These are two glycoproteins, and these subtype of classification based on the variation in these antigens, right? So almost all variant of the H antigen, all variant of the N antigen cause disease in the birds. But H1, S2, S3, H5, F7, and H9, and N1 and N2 only cause disease in humans, right? Of all of these subtypes, we see the H1, we commonly see H1N1, that is swine flu, and S3N2. That I already told you how flu virus is spread. When a infected person with influenza virus cough, sneeze, or talk, they produce the droplets. The droplets become suspended in the airs. When a normal healthy person inhale this infected air, they got infected with this. And if we talk about the infectivity, स्प्रेडिंग ऑफ इन्फेक्शन, एक जो डिजीज पर्सन है उसे जो इन्फेक्शन का स्प्रेड है वो सिम्टम आने के एक दिन पहले से शुरू हो जाता है, एंड इट परसिस्ट अप टू 7 days, राइट? एंड द चिल्ड्रंस those are infected with the flu virus may spread disease more than 7 days. And if we see the symptomatology of these viral diseases, influenza-like illness, S3N2, SARI, and COVID-19. If we compare the symptomatology of all these infections, fever, myalgia, cough, lack of energy, sore throat. These are all 5 common symptoms that are which are present in all these diseases. So अगर आप डिफरेंशिएट करना चाहें 5 चीजों की वजह से, बुखार की वजह से, बॉडी एक की वजह से, कफ की वजह से, लैक ऑफ एनर्जी की वजह से, सोर थ्रोट की वजह से, तो आप इन डिजीज में डिफरेंशिएट नहीं करते। दे ऑल अपीयर्स लाइक सेम, ये सभी एक जैसी दिखती हैं, इनके सिम्टम्स एक जैसे हैं। डिफरेंट क्या है? ब्रेथलेसनेस, सांस फूलना। सांस फूलना इन्फ्लुएंजा में हो भी सकता है, नहीं हो सकता, लेकिन S3N2 सारी और कोविड-19 में होगा ही। एंड if we talk about the COVID-19 में जो स्पेसिफिक सिम्टम है वो है टेस्टना आना और लॉस ऑफ स्मेल, एंड अदर देन दिस डायरिया। ये दोनों सिम्टम, लॉस ऑफ स्मेल, लॉस ऑफ टेस्ट, डायरिया, ये इन्फ्लुएंजा S3N2 सारी के साथ नहीं है। नेक्स्ट, हेडेक। हेडेक इन सारी डिजीज के साथ हो भी सकता है, नहीं भी हो सकता है। सो इट इज नॉट वेरी स्पेसिफिक सिम्टम्स। And next to that, what is warning sign of flu? This is a very important slide. If you see, when we should look for emergency, when we should look for hospitalization, when we should look for doctor. In adults, any patient who have fever, cough, throat pain, feeling shortness of breath, difficulty in breathing, or heaviness over the chest, pain in the chest, he should seek for the doctor. Or any patient have fever, symptom of dizziness, or CNS symptoms like confusion, severe abdominal symptom like persistent vomiting. These patients should seek for the emergency visit to the hospital. And one more thing, if any patient initially got better with the flu symptoms and again develop or again worsening or present with the worsening of symptoms like fever or cough, they should visit the emergency. If you see the same warning sign for the adult, if any if children are fast breathing or trouble in breathing, or skin is bluish in discoloration, or they are not able to take drink, or not able to walk, and if child is so irritable, and if any child have rashes with the fever, they should seek for the emergency. They should go for hospitalization. And if any infant suffering with the symptoms of flu and not able to eat, having trouble in breathing, and having symptom of hypovolemia like no tears when crying, or less use of less number of diapers, if any of these 4 points present in infant, they should go for the hospital for evaluation, right? So this is a very important slide, very important point. Always you should remember when to visit emergency, or when to ask your patient to come to the emergency. And now, what complication of our flu patient get? Our flu patient may land up in the pneumonia or bronchitis. Our flu patient may develop ear infection, or he or she may develop ARDS. Or if our chronic respiratory disease patient, like patient of the COPD, asthma, got infected with the influenza virus, they may land up in the exacerbation of these diseases. And in severe cases of the flu, patient may die with influenza infection. Now, let's talk about the management of the influenza. As almost similar to the all viral disease, mainly जो treatment है वो largely supportive. Supportive management is the primary management of the influenza. What you can support? If patient have cough, you can give cough suppression. If patient have fever, you can give antipyretic. If patient have body ache, headache, you can give non-steroidal anti-inflammatory drugs. And you can advise for bed rest too. And other than these things, you should advise to your patient for drinking plenty of water. right? Almost all, or you can say almost more majority of the patient recover in 3 days. But body ache, letharginess, malaise may persist for the weeks. And if we talk about the antiviral drugs, what antiviral drugs we have for the management of influenza? We have basically two types of antiviral. One act on neuroimmunase inhibitor. One are neuroimmunase inhibitors. They block the viral neuroimmunase and they prevent the replication of the virus. Second group is adamantins. They block the internalization of bacteria. Right. The basic difference between these two groups is neuroimmunase inhibitors act on both subtype of the influenza virus that infect the that cause severe disease in the humans, that is influenza and influenza B. But adamantins like amantadine and rimantadine, they are only going to work on the influenza A virus. If we talk about the neuroamidase inhibitor, oseltamivir, it is almost approved in more than 100 of countries, and it is a first and potent selective inhibitor of neuronet enzyme of the influenza virus, both subtype, and it is a product. When it it reaches in the gut and absorbed in the intestine, it converted in the liver, it converted into oseltamivir carboxylate. And that what I already told you, it work on both influenza and influenza B virus. So you not to think about the what type or what subtype you have. Basically, what it did, basically it did spread of the infection and replication. This is a mechanism of action. Here you can see a round circular virus in which central is the genetic material of the virus surrounded by a polysaccharide capsule in which you can see spikes. Here is two types of spikes. One is hemagglutinin and second is neuroamidase. And if we see the respiratory epithelial cell contains sialic acid. So what these two glycoprotein of the influenza virus do? Hemagglutinin is important for the adhesion of the virus particle with respiratory cell. Right? This adhesion is important for the internalization of genetic material of the virus in the inside cell, where it replicates, and then next step comes. What happened in next step? Neuroamidase cause, you can say, it is responsible for the release of this virus particle. So what our drug neuroamidase inhibitor block? It blocked this dissociation. By blocking this dissociation of virion from the cells, it prevents the replication of respiratory influenza virus. Here you can see the doses of the oseltamivir. It's for the treatment purpose, it is 75 milligram capsule twice a day, and for the prophylactic purpose, it is 75 milligram capsule once a daily for 10 days. And if it is prophylaxis is we are giving for the community outbreak, you can extend up to 6 weeks, or in immunocompromised, it can extend up to the 12th week, 12 week of community spread. And also oseltamivir 30 mg capsule is also available. They are the capsule for those patients who are less in weight, less than 15 kg of the weight. Now let's see what the clinical trials say to us about the oseltamivir. First, I would like to start with a case report. You can see here a 50-year-old man, former by occupation from India with no underlying comorbidity condition, was referred to our tertiary care institute, Srinagar. It is basically for case from Srinagar. Case, the chief complaint of the patient was low-grade fever, sore throat, myalgia, and myalgia for 7 days. He denied any history of chest pain, breathlessness, orthopnea, vomiting, or diarrhea. Before referral, he had received antibiotic in the form of ceftriaxone and levofloxacin without any improvement. So catch-me point is that here is patient is not getting improvement with antibiotics and having symptom of upper respiratory tract infection with generalized body ache. And his vitals was pulse was 110, blood pressure was 110 by 72 millimeter mercury, temperature was 100 Fahrenheit. On checks examinations revealed bronchial breathing associated bilateral pores cracks in inframammary area. His creatinine phosphokinase and LDS were high. Mid-tone interstitial infiltrate on chest radiograph. Nasopharyngeal swab was taken. PCR which revealed positivity of H1N1 influenza A virus. So here you have clear-cut case of H1N1 influenza. So here you can see the X-ray of the influenza patient. Here you can see reticular opacity in the center of the chest. And the treatment given was oseltamivir 75 milligram twice a day, analgesic, oral hydration, and hand wash. Patient got improved with these medication and with progressive decrease in the CPK and LDS and subsidence of the inflator on chest radiography compared with the radiography before receiving oseltamivir. Here it is another prospective study over the oseltamivir on 3,564 patients. What it shows? It shows use of oseltamivir in influenza illness reduce antibiotic use by 26.7%. It reduces lower respiratory tract infection and use of antibiotic therapy by 55%. And it also reduces hospitalization by 59%. This is the another study that give answer when to start oseltamivir. In this study, 442 patient was taken. Median time for symptom onset to oseltamivir administration was 5 days. And here you can see the use of oseltamivir reduce the severity of pneumonia and probability of severe pneumonia increase gradually with the time for the symptom onset to oseltamivir and administration. And second finding was of the study is early initiation of oseltamivir administration after symptom onset significantly reduced occurrence and severity of pneumonia and shortened hospitalization due to pandemic H1N1. Here in this slide, you can see the patient of the influenza who are kept on oseltamivir need less days of hospitalization. Here, another study shows the importance of the use of oseltamivir with azithromycin in combination for the reduction of secondary bacterial infection. Here in this study, 227 patients is taken in the oseltamivir and azithromycin arm, and 102 patients taken in the oseltamivir. And the use of oseltamivir with azithromycin significantly reduced secondary bacterial infection, and it also reduces the need of respiratory support, both invasive and non-invasive. It reduces the hospital stay, and it also reduces the severity of the symptoms. Now let's talk about what the guideline recommended. What recommending? All the guideline given by the guideline given by WHO, Indian guideline, all recommend oseltamivir both for prevention of H1N1, for prophylaxis, and for the treatment purpose too. Here you can see the guideline given by American Thoracic Society. In influenza positive cases, they recommend anti-influenza treatments such as oseltamivir be prescribed for adults with community-acquired pneumonia who test positive for influenza. And use of oseltamivir associated with reduced risk of death in patients hospitalized for community-acquired pneumonia who test positive for the influenza virus. And patient who were treated within 2 days of the symptom onset or hospitalization may result in best outcome. Thank you. Thank you, Manohar. Let's go on the question answer session.
Yeah. So there are few questions by the attendees which is being raised, which I shared with you. So what I'll request Dr. Rathi to, address the questions. Sir, you can close your window. Sir, there is a first question.
Close now?
Yeah.
Right.
So Dr. Ankit, there is a first question is that is flu vaccine is effective against all types of flu and cold viruses?
It present trivalent, tetravalent, and trivalent vaccine are available. They almost cover most of the strain of influenza and influenza B. I think S3 and 2 strain is not present in current vaccine, but because it is this vaccine cover almost all the strains, so most probably it will also be effective on these strains, right?
That is your view on the same. Hello. Rathi sir, your voice is not audible. Hello. Ankit sir, my voice is audible?
Yeah, you are audible.
Yeah.
I think जो flu vaccine है ना, दो all flu पे तो वैक्ट है, लेकिन not all cold viruses. It is basically flu vaccine, so it's going to prevent flu infection, na? Not cold, all cold.
Right. That is true. So, sir, आवाज आ रही है?
मुझे आ रही है, आपको आ रही है मेरी आवाज?
हाँ सर, अभी आ रही है
सर. Fine.
So the first question is that, sir, your view on the first question, sir.
Can you just repeat the question? Sorry, I missed that.
Yeah, just a minute, sir. So is flu vaccine is effective against all types of flu and cold viruses?
So I think answer is very simple. Flu vaccines are only protective against the strain which are there in that current vaccine. So if you ask me, the common question will be whether H3N2 is covered with flu vaccine. The answer is no, because that is not the strain which is available as of now. But yes, H1N1 and all the previous strain of last 5 years or so, they are all covered in the current vaccine which is available. But H3N2 will be available or will be included vaccine next year, because you have to take the samples and then you have to process it. So but again, on a clinical note, you have to take vaccines if you are not vaccinated, because H3N2 is not the only strain which is going on. There are already H1N1. In fact, we in Mumbai, we have already seen so many H1N1 patients, and patients are dying off because of H1N1 still. So you have to take vaccine if you are eligible, and if it is available with your side, so please take vaccine. But yes, this H3N2 is not covered as of now in this vaccine.
Right. So the next question is, who are at the risk of developing the complications from influenza? Dr. Ankit?
That I already told you, who have the any previous chronic lung disease, chronic liver disease, renal disease, or any chronic disease, or who are having this warning sign. Those are the group of the patient who are going to develop complication from the influenza. Right?
Sir, you would like to add anything? Rathi sir, you would like to add anything? Okay. Then the next question is, which are the conditions where the antiviral chemoprophylaxis is necessary for influenza?
Okay, so I think that's a very so prophylaxis is something which you need to understand upon depending upon your local epidemiology. So if I say if I see in Mumbai a lot of H3N2 going on and probably a lot of flu going getting sicker, I'm justifying giving all this it's come from them and been diagnosed as H3N2 and people are staying close to them the study in that slum area or in the zone where there is an endemicity, you have to
Dr. Ankit, would you like to?
I think I would like to add some more point. If any patient is suffering with chronic respiratory disease like COPD, asthma, lung cancer, they must take the chemoprophylaxis for influenza.
So the next question is, what is the recommendation of oseltamivir in patients with hepatic and renal impairment? Any dosage adjustment related?
guidelines are very simple. You can't use because the drug gets activated in liver, so that carboxylate becomes activated in liver only. So but till stage 2 you can use it very well. That is about hepatic. And about renal, if patient is on end stage renal disease, or if your creatinine is say less than 15 or 20, or if patient is on very stage 4 CKD, then probably you can't use Tamiflu. Otherwise, till the eGFR is more than 30 or 45, you can safely use oseltamivir. What we do in our practice is that the moment your the creatinine or eGFR goes less than 30, we cut down dose by half. So that is what we do. So we make it 75 milligram OD. Otherwise, you can use it very safely till your EFR is more than 45, and in hepatic you can use it till child buck 3.
Right. So that's all from our end, sir. Basically, these are the questions which is being asked. So, sir, anything else you want to add, sir? Okay, sir.
I think one question left. What are the contraindications of oseltamivir? Yeah. Any patient who shows the hypersensitivity during the previous vaccination with the dose of oseltamivir, that other than this, I don't think any contradiction for the oseltamivir.
Right, sir. I think, sir, that completes the entire agenda for the today's discussion. On behalf of Hetero Healthcare, I would like to thank both the speaker as well as the attendees who attended this particular webinar on current flu, what's new in flu, and that is the current challenges and the management option. Whatever the the information being shared on this platform definitely will be useful in the day-to-day clinical practice, and I hope it will definitely add value to the patient's life, and it will help at the end of the day improving the quality of life of the patients. So on behalf of Hetero Healthcare, I would like to thank both the speakers as well as the attendees for taking a time for this today's webinar and making your valuable contribution. Thank you, sir. Thank you, both of you. And thank you all.
Thank you.
Thank you. Bye-bye.